Today, I want to talk with you calmly and honestly about something many women notice quietly, but often ignore for too long. Changes in pelvic organ support are more common than most people realize, and they can begin much earlier than many women expect. This conversation is not about fear, it is not about alarming language or dramatic conclusions. It is about awareness and about understanding what your body may be signaling long before serious discomfort appears. Many women are taught to ignore subtle changes, to assume discomfort is normal, to believe that if something is not painful, it is not important. But the body usually speaks softly before it speaks loudly, and learning to listen early can make a real difference. Let us start with simple language. Inside the pelvis, several organs sit close together. The bladder, the uterus for many women, and the bowel share a limited space. These organs are held in position by connective tissue, ligaments, and a group of muscles known as the pelvic floor. When everything is balanced, these structures work together quietly. You do not notice them. Daily life feels normal. You move, you exercise, you work, you live without thinking about pelvic support at all. But when support weakens or stretches, changes can begin slowly, and this point is very important. They usually begin slowly. The body rarely changes overnight. More often, it adapts gradually. That is why early signs are easy to miss or dismiss. A helpful comparison is fabric under tension. When fabric is new, it holds shape well. It supports weight evenly. Over time, with repeated strain, the fabric may stretch slightly. At first, the change is subtle. You barely notice it. But under repeated pressure, the change becomes clearer. The fabric still exists, but it does not behave the same way it once did. The body works in a similar way. Now let us talk about early signals, because early signals are rarely dramatic. The first early signal many women describe is a feeling of pressure or heaviness in the pelvic area. Not pain, not sharp discomfort, more like a sense of downward weight or fullness. Some women describe it as feeling tired in the pelvic area. Others say it feels like something is gently pulling downward. It may feel unfamiliar rather than painful. You may notice it later in the day, after standing for long periods, after a long walk, after lifting something heavy, or after a physically demanding day. Often this sensation improves when you rest or lie down. That pattern matters. When a symptom changes with activity and improves with rest, it gives useful information about how support structures are responding to load. If this sensation appears occasionally, it may not seem important. But if it becomes repeatable, if you start to notice a pattern, your body may be asking for attention. Another early signal is a sense that something feels different internally. Some women describe a mild fullness, others describe a feeling that something is lower than before. Some notice it only in certain positions, such as squatting or standing for a long time. At early stages, this feeling can come and go. It may disappear when lying down and return after activity. That does not mean it should be ignored. It means it is dynamic, responding to pressure and movement. Now let us talk about intimacy, because this is where many women first notice changes. Intimate sensations can change subtly. You may notice less tightness than before. You may notice more air movement. You may notice sounds that feel uncomfortable or embarrassing. You may notice that positions that once felt fine now feel different. These changes can be confusing and emotional. Many women immediately assume they are doing something wrong or that they are somehow failing their partner. I want to say this clearly. These changes are not about effort or failure. They are not about attraction or desire. They are often mechanical changes in how tissues respond to pressure. When support changes, the experience changes. That is information, not judgment. Another group of early signals involves bladder patterns. Some women notice small leaks with coughing, sneezing, laughing, or jumping. Others notice urgency that feels stronger than before. Some notice they cannot delay as comfortably as they used to. These patterns can feel frustrating or embarrassing, which is why many women do not talk about them. But they are common early signals that deserve attention. Not every bladder change is related to pelvic support, but when these patterns appear together with pressure or heaviness, they are worth discussing. Bowel habits can also be part of the picture. Frequent constipation, regular straining, a feeling of incomplete emptying. These patterns increase pressure inside the pelvis. Over time, repeated pressure can influence how support structures behave. Addressing bowel habits is not just about comfort, it is about reducing ongoing strain. Now, I want to explain why noticing early matters, because early stages often respond best to conservative steps. That means non surgical approaches focused on support, strength, and habit changes. At early stages, many women can stabilize symptoms, some women can reduce them significantly, and many women can prevent progression. But early stages are sometimes missed unless you ask directly. Not because clinicians do not care, but because early changes can be subtle, and routine visits may not include detailed pelvic support assessment unless specific concerns are raised. So I want to give you language you can use. If you speak with a gynecologist or pelvic health specialist, you can say, I have noticed pelvic pressure or heaviness, especially later in the day. I have noticed changes during intimacy. I sometimes leak with a cough or sneeze. I have constipation and I am concerned about pelvic support. Could you please assess pelvic organ position and pelvic floor function? That language is calm. That language is clear. That language is responsible. Now let us talk about what you can safely do right now. The first step is observation, not panic. I recommend tracking patterns for 1 week, not obsessively, just attentively. Notice when sensations appear. Notice what makes them worse. Notice what makes them better. This information helps both you and your clinician understand what is happening. The second step is reducing strain. If constipation is present, address it early. Constipation increases downward pressure. Even small improvements can reduce load on pelvic support. Gentle steps often include adequate hydration, fiber from foods you tolerate, daily movement, and avoiding rushed or forced bathroom habits. The third step is pelvic floor awareness. Pelvic floor exercises can help, but only if done correctly. Here is the key principle. A correct contraction lifts inward and upward. It does not push downward. If you try to contract and feel pressure downward, stop and seek guidance. A gentle way to begin is this. Sit or lie comfortably. Relax your jaw and abdomen. Breathe in gently. As you breathe out, imagine lifting the pelvic floor upward, as if stopping gas and urine together. Hold lightly for 2 to 3 seconds, then fully relax. Relaxation matters as much as contraction. Muscles need to release in order to function well. If you feel unsure, pelvic floor physical therapy can provide clarity quickly and safely. One more important habit change involves breathing. Holding your breath during effort increases pressure. Exhaling during effort reduces it. When lifting, standing, or climbing stairs, breathe out rather than bracing. This small change can make a meaningful difference over time. Now I want to normalize something. Many women feel embarrassed by these early signals. They avoid talking about them. They wait and hope they will go away. But these are body mechanics, not personal shortcomings. When you respond early, you gain options, and options create confidence. In the next video, we will talk about why pelvic support changes happen, the main risk factors, and which ones you can influence regardless of age.